Hey guys, it's Dr. Justin Marcagiani here. Today's going to be a phenomenal podcast. We have Dr. Stephen Lin from down under in Australia. He is a holistic dentist, and we're going to drop some serious knowledge bombs connecting functional medicine and nutrition to your overall dental health. So Dr. Stephen, welcome to the show.
Thanks, Justin. It's such a pleasure.
Oh, great to see you here. Your site's Dr. Stephen Lin, LIN.com, and you had a new book that's out called The Dental Diet. So really excited to kind of dig in because most dentists, they don't really connect the nutritional components with healthy, gums and teeth health. Can you just kind of, why is there such a disconnect? Does it start in dental school because there's not much nutritional? Why is that disconnect present?
Yeah, absolutely. And so just as a background, so I was trained in biomedical science before I went to dental school, and I kind of background in sports nutrition, and I always kind of, thought about how performance and your lifestyle affected your overall health. And so I found dental school took that away from me. And so you go into the dental practice and, we see very sick people all the time. We see rotten teeth, we see gum disease, and it's some of the worst conditions and the most common conditions people suffer in society. Yet I had no answer as to why it was happening. And so I could fix it. And, once you get out to the dental world, it's very empowering. You can fix someone's smile. You never change anyone more than when you fix their smile. But, I began to get disillusioned with it because, there weren't a lot of answers as to why, besides sugar and tooth decay. Gum disease was really, we generally call it idiopathic. There was no answers as to why kids don't grow jaws anymore today, why teeth don't fit into mouths, why kids need braces, why wisdom teeth impactions occur. We just rip them out. And so I took some time off work and I accidentally came across a book in a hostel by a guy named Weston A. Price. And in 7 years of practice, I'd never heard of nutrition and physical degeneration. That was kind of my awakening moment. And from there, I went down the road to writing the book, The Dental Diet. But it was many years, and I realized that there was so much science out there and so much understanding about the body that we'd missed, and that our teeth are the first signs, that we really kind of need to get back to that.
100%. I think there's a lot of assumptions too with dentists or chiropractors or medical doctors that, hey, you went to school for this long, you spent so much money on it that you had to have gotten access to all of the information that matters while you're in your training or residency or medical school, right? And that's an assumption where that's really not true. And it takes 20 or 30 years, of time to really influence and move and shift the curriculum. And so because of that, all the training that people are getting is really decades old. And also doesn't, hurt the fact that lots of major, corporations and interests like big pharma and such have a major influence on what you get taught, because you don't want to develop tools and learn information that may outcompete against procedures or medications that are just fixing the symptoms. So you made some really awesome points there. Any comments on that last piece there?
Yeah, look, you're absolutely right. And I get a lot of inquiries about this because people ask me, where do I find a dentist that practices stuff? And they have to kind of realize that, the information isn't readily available unless a practitioner has gone out and sought it. And so all the issues that you brought up there are unfortunately present in the graduates today are receiving an education 30 or 40 years old. And this is all sped up a lot in the last 5 to 10 years in the information age, social media. People that are kind of savvy and following influencers are watching and seeing more scientific research than a person going through medical or dental school ever will. And so it's a huge issue. We've got this big disconnect now, and we kind of need to piece it together.
100%. My biggest issue with research is to do good research, you typically have to isolate variables. The problem is in functional medicine or natural medicine or holistic dentistry, you're moving so many levers and so many variables. I mean, if you optimize someone's vitamin D, cut sugar out, cut grains out, work on their gut, help work on gut bacteria, work on their sleep, work on movement. There's 7 or 8 variables there. You don't know which lever is the big one for that person, right? That's the issue. With research, it tends to be one lever at a time, and it's the synergy by doing so many things and moving physiology, by changing so many levers and variables, you get better results. I think that's probably the biggest downfall with research is you're just not able to move as many levers at once if you're really doing kind of the double-blind, placebo-controlled type of studies.
Yeah, and exactly. So that's such a downfall with research. And a great example, I think, is that, for instance, why we haven't seen crooked teeth as an environmental problem is because it's so multifactorial. There are studies that show, for instance, tongue ties, that mouth breathing, that chewing. All of these issues are joined, through these studies in one way or another to malocclusion, but we haven't built that overall picture because there's so much going on. And this is really a testament to what kind of Price was talking about. Because you go back and look at his book, he doesn't use these kind of these techniques. He uses anthropology, he uses ancestral medicine, and he uses dental examination. He uses nutritional analysis, and that's functional medicine back in the 30s, right? And we've just lost that holistic perspective. And I really think we've got enough scientific model to get back there, but we need to just overturn this very kind of narrow tunnel vision way of looking at research.
Phenomenal. Now, just kind of diving back into Weston A. Price. So Weston A. Price, for the listeners, was a dentist who did a kind of anthropological research where he traveled to different indigenous cultures, right? Cultures that were kind of untouched from modern man. So they were eating kind of their type of, indigenous type of food. They weren't touching the refined sugar, the processed stuff. So he would go in, he would look at all these different diets. He would also send samples back to labs in the US to kind of test them out. He came in with a theory that he thought he kind of had a bias towards a vegetarian type of diet, I think, to begin with. And one of the things he found was that anywhere there was animal products, that they were consumed. The only places that he saw that were vegetarian tend to be areas where there was just no meat to begin with. And he also had a lot of strong perspective on fat soluble vitamins like vitamin K2. So I want to get your take on K2. Also, if anyone looks at the Weston A. Price book, Nutrition and Physical Degeneration, this was like modern reading in medical schools in the 1940s and 50s. Isn't that amazing? So this was something that doctors were actually reading. Now they're not. And if you just go through the Nutrition and Physical Degeneration book, if you don't even read it, but you just look at the pictures, what you see is really broad smiles, strong jawlines, right? And then the further they went away from their natural type of food, healthy plants, healthy fats, healthy proteins, healthy animal products, the palate got narrower, the arch of the teeth got narrower, and then you see all this different crowding and malocclusion, and you can see it in the pictures just in a few generations being away from that food. Any comments there?
Yeah, it was such a phenomenal and when I first picked up the book, I kind of discounted it because I didn't hear about any of that during my 7 years of tertiary education. Obviously that kind of goes back to what we just spoke about. But Price was doing something well beyond his time. He was talking about, things like nutritional input, epigenetics. He was talking about functional growth. He was talking about craniofacial development. All of these things have not been a part of, medical or dental, the zeitgeist or terminology for the last 20 years. And if you actually dive through it, it was actually lost. So you're right in terms of in the mid 20th century, a lot of this growth focus was actually there. We were expanding palates. We were showing that kids were not developing. And so Price, signaled this in the 30s. And so what actually happened is he published in 38, he died in 48. And pretty much after that, his work was lost. And so it was lost for a number of reasons. There were political reasons. He published other work on root canal therapy and the systemic kind of communication between a root-treated tooth. And that was actually discounted and thrown out by the Dental Association of the time. And he actually founded the American arm of the American Dental Association research arm as well. So he was a huge player. But his work was forgotten, which we tend to do. We need to realize that. He actually wrote about 3 substances in each of these cultures, right? So he actually went to even westernized cultures as well that had people living on traditional diets. So Swiss, Northern Scottish, African, Australian, New Zealand, all of these places. You look through the book and there's beautiful jaws all across the nation. And this is anthropologically been confirmed since. Malocclusion doesn't happen, and it happens in one generation as soon as you eat the modern diet. So it doesn't happen throughout human history. He looked in Peru, he found these caves with these skulls, and there were thousands and thousands of years of people with lovely eruptive wisdom teeth. If you talk to an anthropologist today, they confirm it. They say that, look, it doesn't happen until we start to live in society. And the diet, this is what he kind of really nailed into. He measured what they were eating. He found these 3 key nutrients. And so, like, as you said, the fat-soluble vitamins. And so what he identified was A and D. But he said, well, there's this other one called activator X. And he never identified it. Exactly right. And he never identified it. Must have killed. He must have been rolling over in his grave. The poor guy. And it wasn't until 2007 that Chris Masterjohn actually plugged that in. And so that perspective really shows us why we've been so blind as to how crooked teeth, malocclusion, jaw growth is a nutritional problem, because we didn't know what K2 was and that it works synergistically with A&D. Now, you go through the research, you see all the Japanese research on osteoporosis. This stuff, K2 is so fundamental to how your body distributes calcium. It activates matrix GLA protein, osteocalcin, which if they're not activated, you don't pick up calcium from your arteries and your soft tissues, and you can't put them into your hard structures, your teeth and your bones. And one of the quickest tests is that if you know that spot behind your front teeth and your lower front teeth that gets that buildup that your dentist cleans, that painful spot.
Yeah.
Now, when you get that, I used to see people with this big, thick calculus buildup, and that's a calcified plaque buildup, or tartar. Now, that's in different people. You see this huge, thick calcified buildup. In others, you don't see any, and that it's not from brushing. Brushing doesn't necessarily stop that, but it's an imbalance of calcium. And the problem is they don't have K2 to carry that calcium that's carried in the saliva into their teeth and bones. So this is what Price was talking about. We've lost it, and there's such a story between, and we need to get back to this, because if kids don't grow jaws to fit 32 teeth, we have a big problem as a species.
Absolutely. So vitamin K2 is essential. I'm actually consuming a whole bunch of K2 right now. I got some really good grass-fed butter in my coffee with some collagen peptides as well. Collagen's also really important too, right? A lot of people, they're getting a lot of muscle meat protein, but they're not getting a lot of the connective tissue protein. Can you talk more about the connective tissue, collagen, and healthy bone health, including, your teeth?
Absolutely. So if you think about your gums and your teeth, so your teeth are held by what we call the periodontium, and so that makes up of the ligaments, that makes up of the gums that hold the teeth in place, and then the alveolar bone underneath. So basically, what you've got there are the building blocks of your joint and musculoskeletal system, all in your mouth. And so it's unique because they're exposed to the outside world. So there's an immune reaction there as well. So when your body can't manage your periodontium, it's a sign that your body as a whole doesn't have the raw nutrients to build healthy joints, healthy skeletal system. And so collagen, the building blocks of all this, this is what Price found, is that people treasured foods that were rich in fat-soluble vitamins that manage the bones. We know that the AD and K2, how that manages that calcium. But to make the gums and to balance collagen in the body, you need those raw building blocks. And so the time-cooked soups every culture would have, and that Price actually put his patients on the reverse tooth decay. And for instance, the fatty and skin included cuts of meat that we've kind of seen as bad because we don't, we think that they're full of fat, and we have breast meat, and it doesn't have these nutrients that build healthy gums, healthy skin, healthy bones. And so that's something that's really been lost and that we need to get back to.
Phenomenal. Now let's go talk about vitamin K, right? Because you mentioned how important it is. And if we look at kind of the anthropological data, what Weston A. Price was seeing in these people's diets, we're getting there's K1 and K2. So let's kind of draw the line. K1 is going to be more of your plant-based foods, right? Like your green veggies, your collard greens, your spinach, your broccoli, your Brussels sprouts. And then we have K2, which is kind of this activator X that Price talked about, which is going to be, your grass-fed butter, your animal meats, some fermented soy products, egg yolks, some raw cheeses. Can you kind of comment on, what these indigenous people's diets look like and what foods were added in that really caused this shift that created the malocclusion, the narrowing of the palate and the arch? What did that look like, Stephen?
Yeah, so what Price noted was that in each society all around the world, no matter what they ate, is that they were 10 to 20 times had richer in fat-soluble vitamins. So ADK2, activated X as he wrote it. Now, the foods that he found, he said, in each society, they treasure this group of foods. And it was either the foods that you just talked about, it was organ meats, it was egg yolks, it was grass-raised dairy, like in the Swiss Loschenschul Valley that he noticed that they would take the cows up to the fast-growing spring grass. And why? Because it was rich in K1. And so the cows would produce dairy rich in K2. And he compared that butter from the Swiss mountains to the butter back home in the US. And this is back in the 30s, by the way. And he found nearly no K2 in those cows raised back home in Ohio. So you can imagine what you're getting now on the supermarket shelf. So, but what he found is that there was a very careful culture around raising these animal products in a way that from the natural environment, and that would produce these fat soluble nutrients. Now, the reason is because K2 has different types. Now, we call it vitamin K2. And so in medical school and dental school, we're taught about vitamin K, which is K1, which
Right.
is the phylloquinone, which is in blood clotting. And now
Yeah.
it's an important, exactly. Well, the phylloquinone, yeah. So that, and then K2 is the menaquinone. So, and you've got actually
MK7. Yep.
Yeah, two types. So menaquinone 4, menaquinone 7, which is the two types of K2. And the menaquinone 4 is the animal sourced one. And so in the body, it does different things. So kind of when you eat these K2 rich animal products, they're absorbed very quickly. So it goes around your body very quickly. Then K1 and MK7 go to your liver. And so they'll do different things as well. So the body will use K1 and MK7, but then they'll convert both of them to MK4. So you've kind of got this hierarchy of to MK4 from MK7, which is bacterial-derived K2. So there's two types of K2, MK4, MK7. MK7 is bacterial-derived, slightly different job in the body. It probably converts better than K1 to MK4, but you probably need some of this animal-sourced MK4 because that's the one that your body uses the fastest and is kind of the most bioavailable.
Excellent. So we have kind of our K1, right? And then we have our K2, and then that can be broken up into MK4. There's different types of variations there. What type of vitamin K is the gut bacteria producing?
That's MK7, the menaquinone 7. And there's up to 13 of these, and we've kind of called it K2. We probably need to go down and rename all of them. But so the two types of K2 we recognize, and if you pick up a supplement bottle, for instance, you'll see these two types. There's menaquinone 7, which is the one that your bacteria in your gut produce. And we don't really know how much it produces and how much you convert to your body. That's all a little bit unknown at this stage. But we do know, for instance, that we can get it from fermented foods. So when you pick up a probiotic kind of fermented food with live species, it's likely they have MK7. So you get this from cheeses, for instance, because they introduce the lactobacillus species that likely produce K2. And so that's the MK7 type. But then, so the MK4 type, the menaquinone 4, is the animal's source. So the ones that the animal has converted itself from either the phylloquinone or the MK7. So slight difference. They do slightly different things in the body. The MK4s will go to your tissues first, so it's kind of eaten up quickly. Then the MK7 actually will go to your bones, but then travel to the liver again to be converted to MK4. So if you don't get it from your diet, it appears that physiologically we need this dietary source of animal-sourced MK4s.
So basically your MK7, you were going to get that from healthy kind of probiotics type of environment, whether it's fermented soy or other types of probiotics. And then that can then go back to the gut as well and then get recycled into MK4?
Yeah, so there'll actually be, so if you produce in the gut, I think if you've got a healthy gut microbiome, you're gonna be taking care of, because you're gonna be producing those MK7s. It'll be absorbed into your intestine. So what happens is that your intestine will make those chylomicrons and make those lipoproteins, your blood cholesterols. They carry your fat soluble vitamins around the body. The A, D, and K2, all of that, they go into your lipoproteins, packaged up. MK4, MK7, all of that gets packaged up. The MK7 won't actually sit on the inside of your lipoproteins. So the MK4 sit on the outside, and that gets eaten up quickly and taken away. On the inside is the MK7, and that is more likely to hit your liver to be repackaged and converted to MK4 and then taken out in the VLDLs, which is the different types of lipid. So they cycle around more. And so your gut, that's why it's important to have a healthy gut biome, because it's likely helping this cycle out by producing the MK7s.
Got it. So MK4 animal-based, grass-fed butter, egg yolks, MK7, more probiotic fermentation, gut bacteria. MK7 goes to the liver and then can get recycled back into that MK4 animal-based one. Do we have that generally right?
Yeah, that's generally, and there's a lot we still need to kind of map out on that, because obviously
Okay.
K2 is a very, we need more research, but that's generally the physiological process that we understand now.
Great. Yeah, I'll do a video afterwards and I'll kind of boil a lot of the key concepts that you're talking about into like a 5-minute video. So if anyone's trying to follow and they want a more condensed version, we'll put that in the show notes below. Awesome.
Awesome.
So regarding the diet shifts, let's just make sure we have this crystallized. So indigenous culture, Weston A. Price, they were eating fermented foods. They were eating lots of good, healthy fats, whether it's grass-fed milk or organ meats or just really good, healthy animal products. They were eating the skin. They were eating the fatter cuts. They weren't just eating the muscle meats. Like today, we're eating really good full spectrum fats, lots of vegetables. They were avoiding what? The refined sugar. They were avoiding the trans fats. If they were consuming lots of grains, they would tend to be more fermented or produced in a way where they were soaked to decrease anti-nutrients. Can you kind of comment on what their diet looked like and what happened a generation or two later?
Yeah, this is what's really powerful when you kind of take Price's work. When you really step back and see what he was talking about, it was so ahead of his time, because he wrote how once we replace the traditional kind of way of producing foods with the modern food supply, he wrote about how, we bring sugar in, we bring in refined flour, so we take away that
B vitamins.
exactly. Yeah, we take away all of that, and we take away all the preparation around grains, as you just mentioned, to take away all the anti-nutrients. But then he spoke about vegetable oils as well, and this is one it's just so powerful too. Is that, well, we use these fats that we have not used for many thousands of years, and we replace these refined vegetable oils with the fats that our body actually needs. And so when he's talking about fat soluble vitamins, these nutrients need natural fats to be absorbed through the body with the process we just spoke about. So if you eat vegetable oils, your body isn't going to absorb and distribute fat soluble nutrients. So for instance, if you take a vitamin D supplement with a canola oil or a sunflower oil, it's very unlikely you're going to convert that to active blood levels, because your body is going to have a lower capability to digest, absorb, and then distribute vitamin D in its active form. And this is what he was talking about: is that the modern packaged foods that we've replaced with really destroy this traditional and time-honored way of supplying these nutrients to ourselves. And so sugar, white flour, and vegetable oils, which is, if you pick up any packaged food off the supermarket, that's what you're seeing. And so the way I kind of try and frame it, and we talk about this in the dental diet, is that these are the harmful foods. And generally people kind of know the harmful foods, right? We know that, sugar's bad, too many refined carbohydrates are bad. Vegetable oils, I think we need to talk about more, but generally that's getting out there. But if you look at a food and you can't see it as being a source of fat soluble vitamins, or you're not eating that within a day, then you're not getting a food that is providing this nourishment. And so, and if you really think about that, you will not find any kind of modern diet foods that are supplying that. So you have to really think about it in that way, or you're just eating the stuff that's causing harm.
Phenomenal. I mean, that makes so much sense. So a good paleo template is going to be a great starting point, where we get rid of a lot of those refined fats. We're going to get in more saturated fats, more fat soluble vitamins, A, D, E, K, EPA, DHA fats from fish oils, of course, good healthy cholesterols. Also, if you kind of go back and you look at, you mentioned Dr. Chris Masterjohn. I know he talked about him going vegetarian and vegan for a while at some point, and noticing he had a massive amount of cavities after a period of time. So is the cavities and the weakness in the bone just because those fat soluble nutrients are going to be missing in a lot of vegetarian diets as well?
Yeah, so there's an issue here, and he went vegan actually. Yeah, so and so the issue there, that was his whole part. The amazing thing about this is Price has touched people, decades after his death in different ways. And his thing was that he had 10 cavities, and he went into the library and found this book, and he started reading it. And that was his whole trip into understanding why you need to eat these time-honored foods, because he had a mouthful of cavities. But vegetarian vegan diets do strip out these fat soluble nutrients because it's difficult to, well, you can't, by definition in a vegan diet, get these active forms of fat soluble nutrients. This is what Price talked about, is that the foods that contain A, D, and K2, they are from animal sources. That's just by definition. If you are vegan, you are going to need to supplement, and so it's just a matter of understanding, what your body needs and the nutrients it does. And so what he was describing is that when you don't eat vitamin D, you don't get sun. When you don't have K2, when you don't have A, you've got an immune reaction inside your teeth that will provide immunity to tooth decay if you feed it properly. So vitamin D levels, vitamin K2, vitamin A, they feed what's called the osteoimmune system, which is the stem cells that come out of your bone marrow. And so those stem cells become bone-making cells, or they become immune cells. And so inside your teeth, you have special ones as well. They're called odontoblasts. And so they're fed on vitamin A and D. They need vitamin A and D to be activated. They release factors that need to be activated by K2. So this trilogy that he talks about is an immune response inside every tooth. That's why he saw people that didn't ever brush their teeth. They had plaque all over the teeth, but they didn't have tooth decay. That's why tooth decay doesn't happen in any anthropological society in any significant form, because they're all immune to tooth decay. You can't run around in nature and have a hole in your tooth because there's no dentist to fix it. You have to have teeth that are resilient to the natural environment. And these three nutrients provide that resilience. That's why it's so fundamental to human health.
So just repeat that mechanism for the listeners. So the reason why they had all this plaque on their teeth, but it wasn't able to penetrate the dentin, was because what? Say it one more time.
Yeah, so inside the dental pulp, so you've got three layers of the tooth. You've got the pulp inside, which is the artery and the nerve supply. And then you've got the dentin, which is the layer out on top of the pulp. And so that's actually alive. And then so the dentin is then protected by the enamel, which is the white bit you see, the white outer layer of the tooth. Now, the dental pulp inside the tooth, that has got a supply of cells called odontoblasts. Exactly.
Yeah.
So these odontoblasts are sitting there, and they're getting the supply of lipoproteins, what you're feeding your
all those nutrition from your diet.
Yeah, exactly. So they're getting, you're directly feeding your teeth with your diet and they're listening to fat soluble nutrients because it's crucial for the skeletal system. These odontoblasts are sourced from the osteoimmune system. So your bone marrow, they have stem cells in it, and so they'll become skeletal cells, immune cells, or teeth building cells. And so they rely on vitamin A and vitamin D to be activated. So these odontoblasts need vitamin A and D to be activated. We know how that works in stem cells in the bones, and how that, for instance, can affect bone development, for instance, in rickets and these other skeletal deformities. But then K2 as well, because odontoblasts will release immune factors. And what these immune factors do is they'll head out into your dentin, so that middle layer in your tooth, and they'll actually emit an immune response. And so your brain is actually listening to your microbial environment in the mouth, and it's responding. So if there's an insult, there's a system there to kind of to wall it off and build reparative dentin and stop it. But there's also a system to kill any bacteria that are causing any kind of problem. So AD and K2 are feeding those cells inside your dental pulp, keeping your dental enamel and dentin from ever getting tooth enamel without scrubbing the surface. Scrubbing the surface is a very superficial way of looking after your teeth.
Got it. So we have the outer layer, which is the enamel. One layer in is the dentin, and then one layer below that is the pulp, and that's where all these odontoblasts and all these cells and the blood supply come in to feed that outer layer. Do I have that right?
Exactly. So they feed the dentin. They feed the dentin. Enamel is actually acellular, so very little cellular. The enamel is actually run by your oral microbiome. So then you've got this communication between your body, which is fueled by these nutrients, and then the biome, which is climbing up the dentin tubules, which is in the enamel, and communicating with the dentin. So you've got this amazing immune and microbial communication happening in each of your teeth. It's just like the gut. It's fascinating, and yet we see it as something we just scrub and disinfect. And what you eat and what you feed, it really is the key way in order to prevent these diseases.
Love it, love it. And for anyone that wants to get more info, we'll put Dr. Lynn's book in the Amazon link below in the description. So make sure you click that and get that book to get more of this awesome info. That's amazing. So if you're going in and you're seeing your dentist, right, and they see maybe a slight shadow in that enamel or dentin area, and they're saying it's a cavity, we should drill it out. What's your perspective? Should we work on some dietary strategies and watch it and then see if we can get some recovery? What's your perspective on being able to recover maybe that shadow kind of cavity area that your dentist may see?
Yeah, so there's different levels of decay. So if you have, so what we call is generally the classifications are as whether the decay has eaten away the enamel, or you have that kind of enamel as kind of shadow, which is where you've got some, whether it's the dentin or some underlayer of the tooth is affected by decay. So if the enamel is still intact, you still have the structure there to be able to remineralize. Now, you may not be able to. You need to monitor this because decay can continue on. But what you need to do is to get that immune system, regardless of whether you have a filling or not, you need to get this into action. And so the first thing you want to do is get your vitamin D tested. The second thing you want to do is get your levels up quick smart to start that immune system, because that's what's gonna fire into your dentin to get that reparative dentin going. So you have the structure there. Once you lose the enamel, the white part of the tooth, you can't rebuild that. So you may need a dental restoration cosmetically or structurally to replace that. But if there is a shadow, as you described, and there is, radiographically, there's enough tooth structure there, you have the physiological capabilities to affect that. If you change your diet, I would probably recommend some supplementation in that situation, because we want to try and get some fast healing. You want to get K2 in there. I'd say you want to get some A as well. So something like a cod liver or an emu oil. And you probably want to, I would say people like that usually are pretty low in the range of their vitamin D level. So they're going to need to take 5 to 10,000 IU of vitamin D. And then, a K2 maybe up to about, 4 to maybe 500 micrograms a day to really kind of kickstart and see. And you're going to have to monitor it, right? So I make sure that my patients are monitoring their vitamin D at least 4 times a year at an absolute minimum. But in that case, you probably want to go a bit more detailed. So probably 8 weeks, check again, and reaffirm how you've changed your diet and see how your body's reacting, because there's probably gut issues and everything else on top.
So if you see a slight shadow, you can recover that. But if it's just totally like a hole or a black spot, that's an area that probably has to be filled. Would you agree?
Well, yeah. So the enamel, if you lose the enamel, which is the outer layer, that you don't have that ability as such to rebuild, because that's acellular. So the cells in the tooth, once it's formed, live in kind of the dentin. So the dentin has the capability to rebuild. The enamel, no. Yeah. So you're probably going to need a dental filling to kind of replace that. But first of all, you want to get that physiological process back in play. So the surface layer is the least of your worries. You want to make sure your body is managing, its osteoimmune system at the core.
So how could you have your dentist show you this? So you'd be looking, hey, they say, hey, you have a cavity. You're like, hey, show me the x-ray. What would the patient look for on that x-ray? So if it's a shadow, it can be recovered. I just want to make sure I understand these specifics. What does that look like?
So what the dentist will look like in the radiograph is that the levels of shadowing in the tooth and how far the shadowing goes into the tooth. So what we'll call grade 1 or grade 2, it will be shadowing just in the outer, the enamel layer.
Yeah.
So that, even by conventional status, can be remineralized. Even most dentists will say that we can monitor that. Now, if it goes into dentin, we're kind of talking grade 3 and 4 there, and that will be into the outer layer of dentin or the inner layer of dentin. And so you'll kind of measure how far the shadow goes into the dentin. If it goes into the pulp, that's grade 5, and you're likely screaming toothache. That's a whole nother story. But if it's into the kind of the outer half of the dentin and teetering into the inner half, you probably have the capabilities, if you're kind of strict with diet and really get measuring your nutrient intake to remineralize that. You still have the structure there, so it's possible.
Excellent. So just recapping, we have our big three layers. We have our enamel. If the shadow goes through here and into the first half of the dentin, we probably can recover it. If we go into the bottom half, we probably need to have that filled. Am I hearing that correctly?
Yeah, so you can have lesions, for instance, that where the tooth is still in place, right, and it's got this decay that's kind of eaten away down right into the pulp. Now, in that case, if the enamel is still there, you may be able to do it. So those deeper shadows might be able to be kind of recovered if you really kind of shoot those D levels up and remove all the kind of harmful factors. If there's a cavitation, it you're probably looking at a dental filling, and the problem is then is you're getting constant microbial infection into the lesion. So that's going to complicate things again. But yeah, so if you see generally into the outer half of the dentin, you do have the capabilities to heal that.
That's amazing. So we want our vitamin D level, what? 50 to 70, 70 to 90?
Yeah, I'd say 60 to 80. That's that kind of,
Okay.
yeah, that's generally the kind of, I'd say for people that have, people that have had chronic vitamin D deficiency often take time, as you would know. But yeah, I'd say if you're shooting above 60 as a starting point, and really see how kind of see how you're going, and if you can see a functional medicine practitioner, because that's you really want to kind of play with those levels and see where your body wants to be at.
Okay, great. So let's create our checklist for anyone listening to kind of help recover your tooth from a cavity. So number one, we have our vitamin D, right? Making sure 60 to 80. Number two, I would say vitamin K, right? So we kind of have our plant-based and our animal-based. And we know fermented foods, we know grass-fed butter, we know egg yolks. Any other foods that you'd want to talk about to increase the vitamin A or the vitamin K? Because both of those are kind of connected. Master John talks about there kind of being this ADEK ratio. Any comments on those foods to up the A and even the K too?
Yeah, so generally, so in the case of a tooth decay, I would be recommending vitamin D and vitamin K2 supplements, just because we want to, and this is only short term. In the dental diet, I really try and get people long term for food, but for you want to get your food based sources of AD and K2, because it comes in that ratio that Master John talks about, and there is really a kind of a natural harmony and balance between these nutrients, and so. Like a cod liver oil for A and D. Emu oil is a great source for AD and K2. So that's one of the rare kind of food supplements that has all three of those. And so that's an option as well. A little bit harder to get, emu oil. Butter oil is a great source of K2, and that gives you the AD and K2. So grass-fed butter oil, emu oil. So I would recommend trying to get a source of that MK4 in there. Whether you're having obviously lots of egg yolks, and
Butter, ghee.
yeah, exactly, butter, ghee, organ meats. You want to try and have a couple of slices of liver a week, and then you're getting that kind of natural balance of fat soluble vitamins, because the body uses all of them together. And like you said at the start, there's really nothing in isolation, and these especially all need each other.
Got it. So cod liver oil is great too. Excellent. Would you ever do like vitamin A drops with like the retinoic acid in the drops at all too, or would you try to just get it from the whole food sources?
You know what? I tend to think that we can get the A from food sources, and especially unless people are really, say for vegans, where you're not having any kind of liver or eggs
Yeah.
or anything like that. I'd say vegans would want to think about that, because it's difficult to get vitamin A, and you're not going to convert that beta carotene enough to
No.
get the levels up in the body. Yeah, so for vegans, I would probably think about a vitamin A supplement, but otherwise, I would just be trying to get and even for people, because people kind of they quease a bit when they think about livers. You can get the beef liver capsules as well,
Yeah.
so that's
Absolutely.
a good option. Yeah, you probably use them.
Yep.
Do Yeah, and so that gives you the full spectrum. I would try and get a couple of little, a few different food sources that you kind of grab. One that you're cooking into meal, a food supplement maybe, and then if your D levels are low, I'd be grabbing the maybe say,
D3.
yeah, some D3 and
Mhm.
K2 alongside that through your protocol, and you really want to move to food in the long term.
That's great. So you talked about vitamin D, probably 10,000 IU's till you get it to that 60 to 80 range. You mentioned the K2 around 500 micrograms and per day. And then how much of the vitamin A per day? What do you think dosage wise there?
Yeah, look, I mean, so it's difficult because we really don't know a lot about how the dosage. So I mean, look, between they say 10,000 IU to 15, that kind of range.
Yeah.
I haven't used a lot of the supplementation in my clinic myself, just because we don't know a lot about the dosage itself. But yeah, that kind of range, maybe 5 to 10,000. I would just go with a little bit of caution with vitamin A, and talk to your healthcare practitioner about that too, just because there is a little bit of kind of stigma around vitamin A toxicity and whatnot.
Yeah, just make sure you aren't pregnant if you're trying to go for the higher dose vitamin A stuff, because that can be teratogenic. And again, just don't confuse a lot of the listeners either. Vitamin A versus beta carotene. A lot of the plant-based foods are going to be beta carotene, which is a precursor to vitamin A and has to get converted. And if you have low thyroid, that can definitely be decreased. And you can see this kind of oranging deposit in the palms. That's a sign that you're not making that conversion. But the big vitamin A, eggs, butter, egg yolks, liver, those are going to be your best sources that are animal based. Cod liver oil. Anything else you wanted to add there?
Yeah, yeah, I mean, basically, yeah, any kind of if you can find some well-sourced dairy, that some raw dairy, kefir is great. We add those probiotic cultures. If you do tolerate dairy, yeah, but with these fat soluble vitamins, that really is the kind of lesson here, is that the active forms, you need to find food sources of the active forms in some way or form. And so the A, as you said, beta carotenoid converts to retinol in the body. The K2 pathway, the K1 to K, that's the same thing as your body. The K2 is the active form as well. The MK4, that's the active form that your body's using. So D2 in for instance mushrooms and whatnot, that's going to compete in your liver.
Yeah.
And
The
you need
ergocalciferol versus the cholecalciferol.
exactly.
Mhm.
Never take D2 supplements.
Right.
But you should be looking at either getting sunlight, but also a dietary source of D3, which only comes from animal products. So that's why we say animal products. We're not pushing a kind of an animal-based diet for any reason, but besides, that's what your body needs nutrient-wise. And so as long as you understand that and you kind of get a hold about what you're comfortable putting into your body, that's the main thing. That's the main message we want to get out there.
Love it. So I've noticed, there's people that have come into the equation here that, their parents didn't eat the best diet. They kind of passed on to them a lot of nutritional deficiencies, kind of like the whole Pottinger cat theory, where, the nutritional deficiencies of our parents are passed down to us. And then we have the narrowing and the crowding, and we have to maybe have our wisdom teeth removed. I had mine removed. What can we do after the fact? Number one. Number two, I had a child 6 months ago. All right. And I see a lot of, being a parent now, I see lots of kids have these helmets on. And I'm seeing that these kids are lying flat on their, in their crib, and their skulls are becoming flatter. And I'm seeing my son, Aiden, no issues with his skull. Now, my wife, high dose cod liver oil, vitamin D levels in the 60 to 80. She takes about 40 grams of collagen a day. I mean, she kind of eats a really good paleo template, lots of good fat soluble vitamins. So I have to assume that the connective tissue and the bone is weaker in a lot of these kids. And just the simple force of gravity on a soft mattress is enough to flatten these kids' skulls, where I'm seeing my son's skull is able to stay pretty strong. And I have to assume the nutrients are playing a part in the skull. It's also connected to what we're seeing in the mouth. Can you comment more on that, and also on what we can do after the fact?
Yeah, that's such an important point, because all of these factors you've just mentioned are all the run-on points to a kid that needs braces when they're 10 to 12. It's all
Yes.
skeletal development. That is all signs that parents can pick up that their kid perhaps isn't developing as quickly as they should. Just to go back to Price, showed that cultures would feed their expecting couples for 6 months at a minimum these nutrient rich diets. They didn't have supplements then. They would have the eggs, liver, butter, cod liver oil before, to make sure that the body was full of these bone building factors. And that's exactly what you've done with your partner. Congratulations, by the way.
Yeah, thank you.
But yeah, what you're doing and what you did with your partner is what these cultures did for thousands of years. And so the body, when we have the nutrients to build these skeletal systems, we build kids with round heads. And that's what these cultures would say. They said, if people eat these foods, they have kids with round heads. That's how they describe it. It's that simple. And what we're describing there is a child is going through crucial craniofacial development in those early years. So breastfeeding is one of the main factors of how we grow the mouth and jaw in those early formative, people would breastfeed up to 7 years, but I mean, first 6 months at a minimum.
Yeah.
But yeah, you can imagine, right?
I know, right?
Yeah, probably not a modern day. But like we say minimum of 6 years, because what happens is that up until 6 months, not 6 years, because up until 6 months, the childhood larynx is actually sitting up against the nasopharynx, and so they can actually suckle and breathe at the same time. And so what happens is at 6 months, it all drops down, and then the kids can start chewing, and that's when you probably introduce some solid foods. But so all of that is how the child craniofacially is developing, and it's connected to what used to happen actually is when a newborn was delivered. The midwife used to have a sharp nail on their pinky finger, and they used to check under the tongue to see if there was a tongue tie. And if there was a tongue tie, which is a flap of skin under the tongue, they would cut it. And so tongue ties actually prevent kids from posturing their mouth the right way. So the tongue up to the roof of the palate, the lips closed, the pressing of the nipple up against the roof of the palate all expands the craniofacial system. And this is all, the craniofacial system is all connected. So we know in studies, for instance, that if you restrict one bone, you restrict the whole system. And so if you get one restricting factor, so for instance, kids that are posturing wrong, so kids should sit up straight, they should breastfeed while sitting up straight, while breathing through their nose, and that's developing a wide jaws and teeth that are going to fit into a nice straight smile. So kids that have, for instance, a pressed skull in one, and it's usually asymmetrical, there's usually a breathing issue there too, because they're kind of posturing a little bit to open their airways. And so we're already having compensation there. So all of these are signs that we need to kind of get our kids back to, these nutrient-rich diets. The nutrients are the kind of like the cogs and wheels of it all. So the way your child develops and the resources you give to it and the strength of their bones. Now, kids I see today where I'm taking their wisdom teeth out, the bone is paper thin, and we cut the gums. I have to cut the gums and then drill the bone away. It's paper thin and I've taken wisdom or teeth out of people with fully developed jaws who grew up on a farm on a nutrient-dense diet. The bone is, this thick comparatively. In kids, it's barely even deposited. And so all of this is a sign that we don't have the bone-building nutrients. And so that's why your child has such a round, kind of robust structure. And there's a functional component, how they breathe, how they chew, how they breastfeed, but the nutrients are the core, kind of the core role. And the vitamin D of the mother is passed to the child. Vitamin D in the breast milk is passed to the child. So all of this is all kind of rotating around, and it really will kind of dictate whether a kid needs braces in the future, because you're influencing their growth. Now, you can intervene in this as well. You can, if you correct a child to breathe through their nose, to put the tongue to the roof of the palate and close their lips, they'll actually grow naturally. This is an area of functional dentistry called myofunctional orthodontics. And so we can correct childhood growth just through function. And so when you couple that with nutrition, we get the kids' vitamin D right, their K2 right, and eating a nutrient-dense diet alongside, some great fiber and gut gut health promoting foods. All of a sudden, kids are growing as they're designed to, and kids respond very quickly. So don't be disheartened if you do have a child that's a little bit behind. You can catch up. And then we do have the model now to kind of expand kids out. If they need a palatal expander, if they need myofunctional therapy to reprogram that tongue, and they might need their nose checked to get them breathing through the nose. This is all a model of dentistry and functional medicine that we can intervene in. It's important for parents to know.
So right now, the actual action steps that people can take, if let's say their child has a flatter head or they're crowding of the teeth, the first thing they can do is, number one, get their nutrition right. And if they're still breastfeeding, make sure the mom eats that, because you can only get what you give, right? So make sure those nutrients are going in so they come out in the breast milk, number one. Number two, if your kid's eating solids, get them on those foods as well. Number three, what else can be done? You talked about some exercises where the tongue's on the roof of the mouth. and you close your lips. What is that one? And then what else can people do from an exercise standpoint, and who should they see?
Exercise standpoint, I mean, the basic premise is that you want your kid breathing through their nose. So if they're a newborn, you know, Price, you kind of he found people and Native Indians, for example, or Native Americans, sorry, after a mother would finish breastfeeding, they would sit there and they would pinch the lips shut. So teaching a child to breathe through their nose by habit. So watch them when they look at the television, for instance. So if you train a kid to breathe through their nose by habit, so we need to close those lips, and so that's a matter of getting that tongue suctioned to the roof of the mouth. And so now I want a quick exercise is that if you suction your tongue to the roof of the mouth, then try and breathe through the mouth. You physically can't, because the tongue creates a vacuum there that you can't get through. That's how you're designed to breathe, because you don't deliver nitric oxide through the nose. You can watch your kid while they're sleeping. Now, their daytime breathing actually will affect their nighttime breathing. So a kid that where their mouth hangs open in the night, that snores, they're being starved of oxygen. This is all grades of sleep apnea, which are harming neural development, brain development, and linked to ADHD and behavioral issues because kids aren't breathing right. So just by going through those steps of watching all these things and reprogramming a child, getting a kid to sit up straight, for instance, and getting them to posture their head directly over their shoulders, that is all a part of this diaphragmatic breathing system that creates a head that's sitting over your shoulders and a jaw that's growing outward with straight teeth.
That's great. So this is, you know, for most parents, this is probably their dream, right? This is doctor's orders. Put duct tape over your kids' mouths at night, right? No talking and just breathing through the nose, right? We're trying to work on that palate extension that may give some parents some extra peace as well as prove oral health as well. So that's great. A 2-for-1, we call it.
Yeah, well, one thing with the tape, so the taping's kind of you've probably seen Metabolic Mike, who's been big on it. So
yeah,
sealing the lip, you know, if you can do a night of nasal breathing, you're going to wake up like you've had 10 coffees, because you're delivering all that oxygen to your brain. But people do have issues with it. So a child might find that, for instance, a little bit scary. So what I try and do is get them to seal their lips, for instance, in waking hours. So do a half an hour exercise where we have the lips taped, and we do a little bit of walking and light breathing, or watching television with the lips taped. And then they get used to, because there's a breathing pattern there, right? So you have to get the child reprogrammed, because mouth breathing is a survival instinct. Getting the brain to kind of be comfortable, and it's all about CO2 balance in the body and deep, slower breathing and the transmission of oxygen when you have enough CO2. When you don't breathe in the right pattern, it takes some time to kind of reprogram that. Yeah. So there's a road. There's Myofunctional Orthodontics and Myofunctional Therapy are all assistants. If you go find a practitioner, they'll help you with this. And some kids will need help because they've, say they're 5, 6 or a bit older, they might need to kind of be reprogrammed. But it's all about reprogramming those habits, and just by understanding, just by spotting and changing 2 or 3 things in your child's day, they're going to respond very quickly.
Wow, that's amazing. I'm going to have you on here for a part 2, because there's so many more questions I want to go down, because we're just touching on so many impactful topics. That's great. A couple of last questions here, rapid fire. Mercury fillings, you try to avoid them in your practice, and what's your substitute?
Yeah, absolutely avoid mercury fillings. The problem with, the thing about mercury is that I haven't been putting mercury fillings in, since dental school. And not many people do. Now, the problem is that some people do have them in the, because they've been placed for the last, 5, 6 decades. Now, you can get tested for your mercury level. So if you have any symptoms, any kind of thyroid, any kind of gut symptoms, any kind of toxicity symptoms, any kind of, in elderly people, for instance, dementia and mental decline, I would get tested for that the levels, and you can have safe removal via what they'll do is they'll place isolation in, and they'll use the proper vacuum procedure so that you don't get that exposure. Now, they've shown that once you remove the levels do go down. So that's step 1. Mm-hmm. Now, composite fillings are a replacement. You just want to be a bit careful, though, too, because a lot of them going around have BPA.
BPA, yeah.
Yeah, so there's some issues as well with estrogen interruption with composites as well. So there's not a lot out there actually that I would just check. For instance, you get a BPA-free composite. If you have any kind of hormonal issues, you just want to be a little bit careful. But there's not a lot out there, unfortunately, at this stage that's a reliable dental.
Alternative outside
Yeah,
of the BPA and the mercury.
yeah. There's not a lot, because the thing is, we need reliability with the restorative material. It's very hard to put fillings in, and so if you have issues with either of them, and so I've seen people with mercury fillings that don't have health issues, for instance, and so I don't think that everyone needs to go and ripping them, right? So you should always go a lot with measuring,
as well.
Testing, because taking a huge mercury filling out might actually be more harmful for the tooth in your body than actually going down the road of just monitoring it and getting everything else right, getting your gut right. And I just don't think that people should be going. Some people really just kind of want to fly in there and remove all these things. Just go by case and really kind of measure what your body is telling you.
Yeah, get tested. Make sure you have healthy gut function, because a lot of the heavy metals are removed by the hepatobiliary system. And if you have poor gut health, you can reabsorb a lot of these things as well. And if you're going to get them removed, make sure you see a biologically trained dentist. I know Dr. Jason or Dr. Stephen is, but there are others here in the States. The IAOMT.org, the International Association of Oral Medical Toxicology, is a great one. I know Hal Huggins trains a lot of dentists as well via these biological techniques where there's, everyone's wearing an oxygen mask. There's a dental dam, a cold water pick. There's all kinds of methods. Typically, even chelation will be given before and after to pull up any metal that may go down the system. Any thoughts on that kind of protocol, Dr. Stephen?
Yeah, absolutely. Exactly. So everything you said there is exactly what you should be kind of looking for. Ask about their protocol of removing amalgam, so that if you do want to go down that road, that they can use all those systems that they're in place. And so one big thing is that there's a big issue with mercury exposure to dentists, because you're drilling these things out.
Highest suicide rate out of all professions.
Yeah, and we really haven't linked that, because I've taken a lot of amalgam fillings out early in my career, and this was before
Have you gotten your mercury levels tested?
I have. I did back in the day, and the thing is, we kind of moved to the system, and so once we did that, it all moved down. So it does work. So if you can safely remove these things, and you can.
Yes.
I didn't have mercury fillings myself. Yeah. So, but it's a big issue even for dentists as well. They're getting a lot of exposure to this stuff.
A lot of autoimmune conditions, a lot of multiple sclerosis, for sure. Gotta be careful of your environment. And then last question here, briefly, what's your thoughts on fluoride? And again, there's fluoride topical, there's fluoride through the water supply. Just quick overview on that.
Yeah. So the main thing with fluoride I try to get through is that fluoride is a treatment. And so we're kind of told that it's a preventative measure. Well, it's not, because everything we've talked about in this, in the last hour or so, is that that this is the real way to prevent. You've got the biological systems to create an immune reaction and healing process for teeth. So fluoride in toothpaste, for example. So the concentration that fluoride is at in your toothpaste is at the concentration that we put into water, and so that's proven to be effective at systemic rate. So when you constantly take it in through water, that will actually be integrated into your tooth enamel, which is a very small aspect of your oral health. And so that's why fluoride toothpaste doesn't make sense, because it's not a high enough concentration to have a topical effect. And so if you do have rampant decay, there are some applications of topical fluoride. It will be a higher concentration than what's in your toothpaste. And that would be, I would always do that with a dentist, but having toothpaste daily, for instance, doesn't make sense, because you're not getting any benefits topically, and you're having a concentration that is based on water. And overall, with fluoride intake in general, I'd be very careful, because we know it does have interactions, with the thyroid and many other things.
IQ as well. IQ connection.
Yeah, the problem there is that there may be a clinical application, but it's a treatment. There's always a downside to treatment. I would make sure you go down the roads of all these other things we've talked about before going, thinking about fluoride as your option for, preventing and reversing tooth decay.
Absolutely. I think the biggest problem with it is if you put it in the water, to get fluoride from your dentist or your physician, I mean, that's a prescription. So you're putting a prescription in the water, and no one's controlling how much water you're taking in per day. So you could be drinking a little bit and getting a little bit, or drinking a lot and getting a lot. And we know in the United States, the CDC is on record saying that 50% of cavities between the ages of 10 and 14 are through dental fluorosis, which is excess fluoride. So I would say fluoride's probably the main cause of dental cavities in this country with our middle teenage youth. Any thoughts on that?
You know what? I really think when you look at the physiology of the mouth, fluoride interacts with a very small, if you kind of draw out a tooth, like all those things we talked about, and you look at the oral microbiome, fluoride affects a tiny little in between bit. You've got the trillions of microbes here. You've got the biological system of the tooth here. You've got the enamel here that's taking in. This is what it does. It gets incorporated to fluoride into the hydroxyapatite of the enamel. That's the point of fluoridated water. That's a very, very small and superficial aspect of your tooth. I think we need to see it as a clinical application. In terms of water fluoridation and everything else, that's not, in my opinion, the most effective way to prevent decay. I think everyone should be thinking alongside of understanding their teeth and biological system better. Fat-soluble vitamins, that's a real way to prevent decay. It's such a small aspect of how we can impact our dental health, and there are systemic effects. And so you really, if you have any kind of symptom that would suggest that that the fluoride is perhaps interfering with something in your body, you're going to need to remove it anyway. So it just doesn't come into my practice, because, and I don't mention it in the book, because there's so much more important things to mention. Like let's get kids eating a nutrient-dense diet, and we've been wasting too much time on fluoride, in my opinion.
Yeah, and there's some natural fluorides in mineral water, like the calcium fluoride and such. We're not talking just the hydrofluorosilicic acid, which is more of the synthetic type.
Yeah, exactly. There's different sources. We don't really know, how that, the different ways the body metabolizes that. The big thing is with the thyroid, because it does compete
it's a halide.
with iodine. So, yeah, exactly. And that's just simple chemistry, right? But that's not well discussed in the dental realm. So if you have any kind of symptoms with thyroid, listlessness, sleep, any kind of mental or in the elderly, dementia, I would be thinking about trying to go back to a nutrient-dense diet, understand the fat-soluble vitamins. That's far more effective. Yeah.
Absolutely. There was a big epidemiological UK study about 2 years ago where they talked about the higher fluoridated communities had more incidents of hypothyroidism, because that fluoride pinch hits for that iodine, which can affect thyroid hormone, like you mentioned, right?
Like you say, it's directly in the it's in the same chemical category, so it's it makes complete sense. Anyone with symptoms, I would definitely recommend that you be very careful with fluoride. And once you put it in its context, it's only in a very small amount of cases we really use it anyway.
Totally. Well, last question here for you, Dr. Stephen. Real quick. So, what's your take on root canals? Are they necessary? If someone's tooth is that bad, do you recommend it being pulled out? Do you do an implant? Do you do a bridge? What's your take? Can it be prevented? If it can't be prevented, what should someone do?
So similar to what we were talking about, those earlier grades of decay, root canal is generally what happens when you have that decay eating down into the pulp of the tooth.
Pulp, right?
And
what happens?
Exactly, the third layer of the tooth. And so what happens is that your body emits an immune reaction, and so often what can happen is that the pulp can die, and when it's dead, it can't emit that immune reaction anymore. And so once it goes past this point, we call it a pulpitis. So when you have a toothache, they call it a reversible or irreversible pulpitis. And so the reversible type will actually kind of be a toothache and go away. The irreversible type is where the tooth is dead. And so that's where there'll be an infection source. There's no immune response in the tooth. And that's either when you need a root canal therapy, which is like a filling inside the tooth, a disinfection of those canals of that infected pulp and a filling inside, or you take the tooth out and look at replacement options. Now, I've seen many root canal therapies. What happens is in irreversible pulpitis, you get this abscess at the bottom of the tooth, and then root canals are designed to take that away. I've seen healing in them, so I think there's some application for root canal therapy, because I don't taking teeth out isn't always applicable for everyone. When you remove a tooth, you need to kind of, so there's a lot of things we need to consider. When you remove a tooth, you need to think about, what kind of replacement options. Bridges and crowns bridges are quite they do have a limited lifespan. Implants are a great option. I'm going to have metal institute, but they're very expensive. If there's any issues or anything, we don't. We are. If you have a problem with an implant, it's going to be, you're going to be very limited clinically what we can do with it. So there are limitations to the treatments we can do. You always need to be thinking about that. Once you get to an irreversible pulpitis, you just need to understand that it is a compromised situation. We're going to need to use a compromised outcome. A ceramic implant is great if you can afford it. But root canals in some situations I think may be helpful to keep a tooth for a few years. Otherwise, if there's any symptoms, if there's any signs of co-infection, if you have an old root canal, for instance, that is symptomatic, or on a radiograph it's got, you can also have a more in-depth scan in more detail. And so if you have a root canal and you have other symptoms of infection, I would definitely be thinking about removing it, because these canals are very, very detailed. And so it's very hard to kind of get this. They seem to be clinically correct. Sometimes, we just have this ongoing infection, in which case they need to be removed.
And so regarding a root canal, that's just basically drilling into the tooth and sucking out that pulp layer and then all of the nerve and blood flow that goes up into the tooth and the pulp. Is that what a root canal officially is?
Exactly. So we're basically putting a filling inside the tooth. So we open it up. The first session is where we kind of take all that infected necrotic tissue out. Sometimes there's still blood supply there. And then you basically go back and you're putting an antimicrobial calcium hydroxide usually into the pulp chamber to disinfect it as much as we can. Now, so the idea is that once it's disinfected, we can then fill it, and then the tooth is sealed with either a filling or a crown, and then we can move on from there. So that's generally the principle. The problems with it is that it's a very, very, very finicky procedure. I think sometimes you may be able to get a good result out of it, but I mean, other times extraction, and it really depends on the tooth structure left as well. So you want to have a close conversation with your dentist about it, see what they're recommending. If you feel okay with that, if they feel okay with it, that really is because root canals are, trying to solve a problem that it's difficult.
And basically, you'd say you need it if you're deeper into that third layer of the pulp, infection-wise. That's where you think you would need it, and you would try to use the natural means and monitor it first.
Yeah, if you've got, so I mean, what happens when you have a toothache or having a reversible pulpitis is your body releases osteocalcin. So they've showed that people that actually don't progress into an irreversible pulpitis have more osteocalcin in it, and that's so stimulated by vitamin A and D, of course, but then you need that K2 to activate it. So you do have a chance. If you've got a toothache, for instance, with a grade 3, grade 4, grade 5, grade 5 is going to be tougher because it's a deeper infection. Then the protocol we talked about in this is going to really help you potentially prevent going to an irreversible pulpitis, because generally what conventional dental medicine tells us is that there's no way to predict that, but the body has healing mechanisms there. So you do have the chance. And so I would try that. If your tooth is still vital, if you still have any kind of signs that you don't have active infection there, you need to go down the roads of correcting physiologically first.
And if someone's already had a root canal, would you recommend them keep it or get it pulled? And if someone's on the fence of whether they should get a root canal, would you push them in one direction or the other?
Really depends on the situation. So if there's any signs of infection, I would suggest removing. If the tooth is, if you don't have any other symptoms and you don't have any other health problems, the tooth is sitting there fine, just monitor it closely. If you're going down the road of root, you need to assess how much tooth structure is there. How confident the dentist is to get a seal, because that's what's going to ultimately suggest how viable the tooth will be into the future. I think root canals, are useful to maintain some teeth. If you have the option of getting a ceramic implant, that's a great option because it's the most biologically kind of compatible. And that's ultimately what we want, but they are very expensive and not available to everyone. So there's a lot of different things you got to kind of take into account.
Dr. Steven, thank you so much. You've dropped some serious knowledge bombs today. Again, everyone listening, click below, get Dr. Steven's book on Amazon, support the cause. Great information there. Dr. Steve, I want to get you back in a few months. There's so many more questions that we have from the listeners, and you're a wealth of knowledge. So I want to get you back here soon. Thank you so much. Everyone listening live, give us a thumbs up, give us a share so we can get more people's dental health improved in the right direction. Anything else, Dr. Steven, you want to say? Again, your book's The Dental Diet. It's on Amazon. We'll put the link below. Your website is drstevenlin.com. Yep,
Yeah,
drstevenlin.com, LIN.com.
Yeah, that's it's been a great conversation. Like this functional and dental conversation, I really think we need to have it. So thank you very much for having me. And this stuff and understanding the mouth and how diet affects the jaw, preventing braces, preventing root canals, gum disease. We need to think about this stuff because all the problems we see down the road really are just a tribute of not understanding what we put in our mouth to start with.
And if someone wants to consult with you, could they send you over their history or their x-rays and stuff to get your opinion on what's going on? Is that available?
So I do consults on. We haven't opened that up yet, just with the book stuff. But if you go to my website, there's a contact form there, and we do have forums, and there's an online program there that they can jump on, especially for parents who are looking to kind of help their kids breathing. So jump on and check that out because it's a great way to kind of help understand all the things you can do at home.
Love it. Well, you're going to be a phenomenal resource for me and my patients as well. So if you guys are on the fence and need an extra set of eyes on things, I think that's going to be a phenomenal resource, Dr. Steven.
Absolutely, man. Yeah, I'm looking forward to chatting more. Let's definitely do this again.
You got it, man. We'll do it real soon. Hey, you have a phenomenal day. You take care now.
You too, buddy.